If it doesn't work, change it, because I want you to think about your sessions with patients and even your personal life. So during the session, I know you're going to learn from several of the practitioners that are always with us: Dr. Dennis Donovan, Dr. Don DeFabio, Dr. Grant Headley, and Dr. Laura Ramus is going to be joining us in a little while. So use this webinar to look for ways to do something different. Everyone on this webinar is really excited to be able to share with you. And in the past, in a previous webinar, I mentioned creating a standard method of charting, about charting our notes. So as our community grows and referrals to each other grows, we have a common method of charting. So this is what I've been playing around with. And if you have any other suggestions, please share them in the chat box. And this is one that I'll talk to Laura about, and we'll start to figure out how we're going to teach this, and it'll be taught in upcoming hands-on workshops. But I do talk about, the A, B, C, D, E, F, G, and the applicator that you're using. We have so many choices. The 40 millimeter, whether that's the round or the convex, and then the 60 millimeter, 70 millimeter rounds. These are all our tools if you're new to us. And we want to welcome you tonight, but understand we have lots of applicators. And then in my notes, you would see the body position that I put the patient in, whether they're supine, prone, side lying, or some type of yoga pose, or in motion. And then I want to know the count time, the duration of time that I gave that treatment, and actually the time that I started my session with that patient. So from beginning to end. And then the dispersal pad for the D, the metal pad, the soft pad, the handheld, and the location of placement of that pad is important. The amount of energy, the power that we're using, I wanted that noted, the frequency of the hertz for the high tens, and then the geography, the body parts that I've treated. And I try to get as specific as I can. So in that regard, I wanted to share with you my favorite or most common Winback treatment. And I want to get my patients into parasympathetic mode. You've heard me say that before. I use the 3 R's, which is come in, let me get you to rest, let me get you to relax, and then I'm going to reboot. So those are my 3 R's as my launch treatment, so that I can explain what Winback into car is all about. I frequently use SOT type blocks or wedges. In the physical therapy world, you might know about these blocks or wedges to reposition the pelvis into neutral. I look to reposition an oblique pelvis or anterior pelvic tilt or posterior pelvic tilts, bilateral anterior pelvis, which will create that hyperlordosis, or bilateral posterior pelvic tilt, which will create hypolordosis. And in the A through G format, you see what I do. I might have that patient prone, and I'm going to start out with the CET and the 60 millimeter round or concave. And I did, typically we'll do 1 minute on, let's say it's the superficial back line fascia that I want to treat. I'll do 1 minute at the left plantar fascia, and then maybe a minute or two on the calf, the posterior calf, lateral medial aspect. I'll do the posterior thigh, checking hamstrings, adductors, iliotibial band, and I'm really feeling for glide or densification or that fibrotic tissue as I'm going along. And then I spend probably, twice that amount of time, like 4 minutes, doing the paraspinals. In up and down lines, along the spine, as well as crosses from left shoulder to right hip and vice versa, right shoulder to left hip. The plate, SP, is the soft pad, would be maybe under the diaphragm or the umbilicus. And I'm using 40% of the CET. So I think you can get a good visual of this, right? while I'm doing that, they're getting introduced to this thermotherapy. I'm training them in breathing. For parasympathetic, I typically use 4-7-8 breath, box breathing, and I am very strong on doing visual healing and or sports performance training and visualization. From the CT, I typically go into the RET, and the patient may still be in let's say, that prone position. Now I'm using the 40 millimeter RET, which looks like this. I love the concave better than I like the IASTM tool, because I do this over the fascial restriction or the densification, where I can really do some transverse friction or cross fiber work, typically over the peroneals or the ischial tubes, or where the glute max attachments and the TFL attachments come together. And you could see I put in the time. I showed you where I put the soft pad. The percentages that I used was 40% RET, 2 hertz for the TENS, and 40% for the EMS. After that, in my notes, you would see what exercise I gave the patient, or what movement therapy or mobilization or manipulation I gave to that patient as well. And then I may or may not apply some of the 6D tape. I love this tape because it already has the tabs in it. So that's a typical session, number 1 or 2 for my Winback experience, and my most favorite one to start them out with. For those of you that are new, I just want you to understand this for a moment, that the things we see and demonstrate with radio frequency is that it generates this heat and it increases the local blood flow. So what we notice is increasing that circulation delivers more oxygen and nutrients to the damaged tissues. It certainly reduces inflammation. There's better lymphatic drainage and better removal of waste products from these tissues. We are certainly stimulating cellular activity, i.e. the fibroblast. There is pain relief because we know we're reducing muscle spasms, and we're accelerating healing by increasing blood flow, reducing inflammation, and stimulating cellular activity. So if somebody asked you, what does this therapy do? These are really the 5 bullet points that you might want to share with patients. And I wanted this month and in the coming months to start sharing articles with you. This is an article that I want to quickly review. It's in the European Journal of Applied Physiology. It's a 2022 article about heat. And the abstract is that an acute increase in muscle temperature by passive heating, which is exactly what we do, right, can increase the voluntary rate of force development and electrically evoked contraction properties. So what we see is the improvements in the rate of force development and evoked contraction assessments with increased muscle temperature after passive heating reveal peripheral mechanisms' potential role in enhancing muscle contraction. But this is exciting because these mechanisms include increased calcium release and uptake, calcium sensitivity, and increased intramuscular fluid. So stay with me on this one. We're elevating muscle temperature. That's thermotherapy, which influences the calcium ions in the muscle cells that include increased calcium release and uptake. It enhances this calcium sensitivity and the fluid within the muscle. This increases muscle mass, growth, and repair. And I want you to get that we're even talking about, what's happening inside the cell, sarcoplasmic endoplasmic reticulum. These channels are really working much faster, and they're talking to each other better. So this shortened contraction and relaxation time potentially improves muscle performance and aids in recovery from muscle injuries or disorders. So again, I want you to, in summary, radio frequency creates friction that creates heat within the muscle that passively increases muscle temperature That's influencing calcium handling in the muscle cells. And it includes both the release and reuptake of calcium ions within the muscle cells. And it shortens muscle contraction and relaxation times. So it's not just blood flow, it's so much more. So with all that said,